Could your back and leg pain symptoms be due to sciatica? That's right, something related to the sciatic nerve. You might have heard this phrase, sciatic nerve or sciatica. This is a picture of the low back, and actually the two big chunky lines that are coming out of each side of the low back going down the legs. Those are the sciatic nerves. You have one on each side. That's right. These nerves are huge. You can see them, right? They're in fact, the sciatic nerve is the largest nerve in the body. But if there are problems with this nerve, it can cause pain in your low back and your lower legs, even more importantly. So you're wondering, okay, well, how will I know if my back and leg pain is due to sciatica? Well, of course, I always have to say, check with your doctor. I am not your doctor as much as I'd like to be. But let me give you some symptoms and signs that some people, actually many people have. First of all, a classic sign is people have pain that literally radiates from their lower back area. Okay, so it starts at the lower back and it goes down to the lower legs and on to the feet or toes. Now it can stop at somewhere down there. It doesn't always have to go down to the feet or toes, but that's generally how it goes. And it's one-sided. So if you have problems with your sciatic nerve, you're having problems with either the left or the right, okay? And that can cause this pain. So it's usually unilateral or one-sided. People generally have more leg symptoms than back symptoms. And it makes sense because you see how this big nerve literally travels from the low back all the way down the leg. The leg is what experiences most of the symptoms that people have. And that pain that people get, that's mostly leg pain, more so than back pain, tends to be pain in the back side of the leg, in the back of the leg, not necessarily the front of the leg. Usually the pain goes below the knee, but as I mentioned, sometimes it can go all the way down to the feet. And symptoms include pain, yes, but also some folks get weakness or numbness or tingling or things like that. And some people describe sciatica pain or pain with their sciatic nerve as pain that's like a jolt or like an electric shock type of pain. Some people get pain that's worsened when they've been sitting for a long period of time. So prolonged sitting can really exacerbate sciatica for many people. And also coughing or sneezing. Interestingly enough, with this type of pain, sometimes it gets worse in people with sciatica when they cough or they sneeze. Now, of course, this is not all the potential symptoms you can have. This is just sort of a smattering of them and some hallmarks and highlights for you. But again, these are symptoms that tend to make up what we generally think of as sciatica or sciatic nerve pain. So what causes this, you say? Oh, there's a few things. A herniated disc, a slipped disc, a ruptured disc can do it. A narrowed spinal canal, something we call spinal stenosis, that can do it. A bone spur, something that sort of compresses or presses on the nerve, can do it. Pelvic injury, there's other things that can do it as well. And the truth of the matter is, a lot of people are like, oh my gosh, what's going to happen to me? Well, look, the symptoms range and thus the treatments do as well. For some people, their sciatica or sciatic nerve pain will go away on its own. Other people need medications or might need injections, may need physical therapy or certain exercises. Some people may even need surgery. I mean, look, there's a whole range and there's other options that I didn't necessarily mention as well. So the big point and the point about this is not for you to diagnose and treat yourself. It's for you to think, oh my gosh, I have been having, back to leg pain more than the back pain, kind of sounds like what Dr. Jen is mentioning, blah, blah, blah. Really what this is about is making sure you see your doctor to get it checked out and making sure that you're getting a proper diagnosis. What I always say is that if any symptoms are new, unexplained, and I should also and this is really important, I think I'm going to do a video, by the way, on the warning signs of back pain, right? Because there are some warning signs that we just never, ever, ever want to ignore. So even though that's not the focus of today's video, let me just give you a couple of signs that you should never ignore. Numbness, tingling in your lower extremities, weakness, loss of your bowel or bladder function, pain at night, pain that doesn't go away. If you're older, if you're younger, there's a few other warning signs as well. But the bottom line is, for any symptom you have, you should be checking it out with your doctor, this included. But just know, if you've ever heard of sciatica or sciatic nerve pain, this is what we're talking about. Guys, I hope this is helpful. Let me know what you think. Let me know if you have back pain, leg pain, sciatic pain, whatever you got. Let me know what you do for it. Please like and follow my page if you have not already. Also, I'm on Instagram at Dr. Jen Caudle, so make sure you follow me there. And consider joining my subscription groups for exclusive content. Guys, I'm Dr. Jen. I'll see you soon.